Now, a few years ago, you and your colleagues introduced a program called the Pipestone Antibiotic-Resistance Tracker, PART, I think is what you call it.
Yes.
How is that going, and what kind of impact is it having?
In January 1 of 2017, we implemented or introduced a program to our customers called PART. And it's what PART really is it's a surveillance program. And we're doing surveillance on resistance, as we discussed earlier. And then we're also providing a platform for those farmers to monitor and track their antibiotic usage over time. And so we think that today this is the only program that we're aware of that provides that service to independent farmers. And so that program has been successful to this point. We've been collecting data now for about 2.5 years, and we're able to benchmark or allow these farmers that are in the program to benchmark their usage with other farmers, which is a value. And then it's also increased and improved the conversations between the farmer and their veterinarian about their antibiotic usage. And so every 3 months, the farm veterinarian reviews the producer's antibiotic usage and submits a report or comments to the producer. And then at least once a year, there's a formal in-person review of all of their data with the farmer and the veterinarian. And so those conversations have led to more discussions about pathogen elimination, alternatives to antibiotics, increasing use of vaccines, et cetera. We think that's been a big success.
So when we talk about benchmarking, is it strictly quantitative, where you're looking at it and looking at how many pounds or grams of a particular antibiotic have been used in these herds over the last 2.5 years, for example? Or does that kind of set the stage for a more qualitative analysis?
We measure by grams of antibiotic per pig on a monthly basis, and we can track how the antibiotics were delivered. So we can break out antibiotics through the feed, antibiotics delivered in the water, antibiotics delivered by injection. We can track it down to the individual drug level, so we know exactly what antibiotics were used in what amounts. And then we also track and benchmark usage by the relative importance to human medicine. And so we use the FDA criteria looking at critically important, highly important, or important. And so there's a lot of discussions about how are we delivering the medications, which products are we delivering, and what's the relative importance to human medicine.
And how have the producers responded to this program?
I've been impressed at the rate of participation and the commitment that these farmers have towards tracking use and doing surveillance on resistance as part of the greater good. All of these folks have families. They are just like you and me, and they want to be able to preserve the effectiveness of antibiotics, not only to treat their livestock, but also their family members.